Hi, I'm Anita, the Advanced Nurse Practitioner in Neurosurgery Spine. After a spinal decompression, the key is to get patients back on their feet as soon as possible to reduce stiffness, improve leg function, and prevent other complications following a general anesthetic such as deep vein thrombosis, pulmonary embolism. Usually, these operations require one night stay and rarely longer than 2 nights. Some patients are prepared for a day case procedure and can go home in 3 to 4 hours after their surgery. There's a lot of evidence to show patients who are discharged early from hospital fare better in terms of their own pain management and early mobilization. About your wound care. At the time of leaving hospital, you should be notified what kind of dressing was used. If it was a steri strip or paper tape that go across your skin, this can be removed by oneself after a shower. If they've used a stitch or staples, then you will be given a clip remover for the practice nurse to remove this. Please make sure you book an appointment with your GP surgery in 7 to 10 days as per your discharge summary. When the wound is healed, you'd notice a lump where the skin has been sewn together. This is quite normal, and the hospital will check the wound before you leave to ensure there's no further bleeding. They would apply a waterproof dressing. However, this isn't foolproof, so your nurse would give you some additional dressings to take home. We advise you not to take a bath for 1 to 2 weeks until your wound is healed well. You could have a shower, but please do not splash water to the back. If your dressing gets wet, please change it immediately. The good practice is not to touch the wound dressing for 48 hours to prevent surgical site infections. If you see a soft ball-like lump with high temperature, headaches, neck pain, and difficulty seeing lights, please report to the surgical team. Please take your regular analgesia for the next 2 weeks and slowly reduce them if your leg pain has improved. It is important you do this as your back will be sore for some time. The usual recommendations are paracetamol, codeine or tramadol at this stage. After a gap of 2 days, you may take some non-steroidal anti-inflammatory medications such as ibuprofen or naproxen if it has been prescribed to you. In some cases, your surgical team may give you stronger opiates. The neuropathic painkillers such as gabapentin, pregabalin, or opiates such as tramadol may be continued and slowly tapered off to avoid any withdrawal effects. 1 tablet at a time, 1 dose at a time in a gap of 3-day intervals. Please maintain a good posture through your recovery phase and avoid sitting for more than 20 to 30 minutes at a time, and alternate by standing, walking, lying down to prevent strain on your spinal ligaments and joints. Likewise, please avoid bending, lifting, twisting or heavy activities for about 4 to 6 weeks. The guide in terms of lifting is about a kettle full of water. Whilst performing any domestic activities, please remember your back and avoid anything that puts strain on your back and break down your loads, and always maintain a spinal alignment. Make sure your work surface or desk is in level with your elbow when you sit down. You may drive after 1 to 2 weeks if you feel safe to be back on the wheel and do emergency stops. Please refrain from any heavy sports such as cycling, Pilates for about 3 months until your back has had a good opportunity to heal internally. You may return to work in about 3 to 4 weeks depending on the type of work you do. And if it involves heavy lifting, then you may need a sick note for about 6 weeks, and this may need reassessment. These are all rough guides, and the general rule is to listen to your body. If it hurts, step back and slowly work your way up. Your surgical team may arrange a follow-up by telephone or in person between 6 and 12 weeks time depending on their practices. You will need this time for your back pain and leg pain to settle down, for the nerves to heal. Numbness takes a long time to resolve, if it resolves at all. But if your leg pain gets worse, please contact your surgical team. A physio review is usually undertaken around 6 weeks' time, depending on the hospital's referral policy. To summarize, most people do very well with these kind of surgeries in the medium and long term. We anticipate short stays and early mobilization is the key. There are a number of websites you can find some useful resources if you like to read more. Thank you.